you doing that led to the hypovolemic shock?
Working in the shop, welding shop, cutting a piece of steel with a cut-off blade when the blade exploded, and the part of the blade went through my face shield, through my chin, ricocheted off my lower jawbone, and took almost severed my tongue.
So did you panic when you started seeing all the blood?
No, being in the shop alone, and the fact that I take blood thinners from heart attack, and knowing that I was going to bleed out if I didn't take every step to get things right. And so that's first thought was, if you panic, you're going to die.
So how did you communicate with 911?
On my cell phone they couldn't understand anything I was saying, but the 911 operator stayed on the phone, and I kept trying to tell them what my location was, but I walked down to the road. I live in a rural area, but I walked down to the road, and thankfully a car came by with a young couple, and they got out, and she took the phone, but they didn't know exactly where they were, not being familiar with the area, and until the mail carrier came and gave them the address, and then she was able to get the fire department from Whitesburg, and when they arrived, they were able to communicate with the ambulance service.
So when the ambulance finally arrived, were they able to stop the bleeding on the way to the hospital?
No, they were treating the entry wound through the chin, when actually the blood was all coming from under my tongue where it severed it.
So did the paramedic on the ambulance panic when he couldn't stop the bleeding?
Well, they were a little excited. They were communicating with the hospital. I had communicated to him when we started, not, please don't let me die from bleeding to death, and he was pretty sure that he wouldn't. But about 5 minutes out from the hospital, he wasn't as sure as he was when he started.
So when you got to the ER, who figured out where the bleeding was coming from?
They had a young doctor that had just returned from Iraq, being an Army doctor in trauma center, that was filling in for another friend just that one day at Tanner Medical Center in Carrollton.
So they took you back for surgery and repaired your tongue and chin, but after the surgery, were you back to 100% functioning?
No, I say 8 days in the hospital, and during that time I had about 4 or 5 sessions with a speech language pathologist, learning how to form words and how to basically learn how to talk again.
So how did your diet change after the surgery?
For the first 3 weeks after the surgery, I was on a pure liquid diet. And then for the next 3 weeks, I was on sort of baby food diet.
So since you were already on heart medications and blood thinners, how were you able to take the medicines?
We talked with the pharmacist, and they said we could crush all of my medications except one, which was toprol. And after the accident, and after they changed the toprol to metoprolol, I was able to crush all my medication and mix them in with my liquid.
So are there any lasting effects from the hypovolemic shock?
None that is medically proven, but it could be that loss of blood flow to my brain has caused me to be a little bit slower than I was, but I'm not sure about that. No, I have a loss of sensation, feeling in my chin, lower lip, and tongue, but other than that, there's no lasting effects from the shock, just the accident.